Wheelchair and wheelchair transfers. This video is being presented by Dipali Gohil, Ishwar Jam and Sapna Jha. This is being guided by Dr. Ekta Bhalra. Wheelchair transfers. The term transfers refers to the movement between surfaces while maintaining a seated upright position. It includes moving to and from the wheelchair in day-to-day life. The transfers on lower surfaces is easier than higher surfaces. A range of strategies are being described here. These are to be explained by therapists in regional and most comfortable language according to the patient. Starting with the basic propulsion strategies, first one is moving forward. Moving forward can be done by propulsion of bilateral wheel in forward direction simultaneously. Similarly, moving backward can be performed by propulsion of bilateral wheels simultaneously together in backward direction. The last propulsion strategy is turning. There are three methods by which turning can be performed. Turning onto the right side using forward approach. Put the brakes on right side and propel the left wheel forward. The next one is turning on right using backward approach. Put the brakes on left side and propel the right wheel backward. The last one is turning onto the right side using both the wheels simultaneously. Turning right can be performed by turning the right wheel backward and simultaneously the left wheel forward. In the same way, left side turning can be done by doing the things on the opposite side.
Moving towards the first strategy, that is wheelchair to bed in paraplegics using the self approach. Aim. The aim is to improve the ability to transfer from wheelchair to bed using the self approach. Patient instruction. Move the wheelchair closer to the brim so that the transfer would be easier. Make approx 40 to 60-degree angle with the brake. Remove the armrest and put the brakes or locks on and move the casters forward. Step 1. Moving on to the front edge of the wheelchair. The elbows are extended and the shoulders are adducted and depressed to vertically lift the body. The shoulders are then extended to push the trunk and legs forward onto the seat. Step 2. Positioning the feet onto the floor. The left arm lifts the right leg onto the ground and the right arm is used to hold the trunk upright. The mirror of this procedure is used to position the left leg onto the floor. Step 3. Positioning the hands. The right hand is placed onto the bed and the left hand on the front corner of the wheelchair. Step 4. Lifting and shifting body onto the bed. The elbows are extended and shoulders are adducted and depressed to vertically lift the body. The right shoulder is adducted and the left shoulder is abducted to laterally shift the body. Step 5. Lifting the legs onto the bed. Weight is borne through the right elbow while the left arm is used to lift each leg onto the bed.
Moving towards the next strategy, that is the reverse from bed to wheelchair in paraplegics using the self approach. Step 1. Lifting the legs out on the ground. The weight is borne through the left elbow while the right arm is used to lift each leg onto the ground. Step 2. Positioning the hands. The left hand is placed onto the front corner of the wheelchair and the right hand is placed onto the bed. Step 3. Lifting and shifting the body onto the wheelchair. The elbows are extended and the shoulders are adducted and depressed to vertically lift the body. The left shoulder is abducted and the right shoulder is adducted to laterally shift the body. Step 4. Shifting and positioning into an upright position. The elbows are extended and the shoulders are depressed to vertically lift and shift the body into an upright, comfortable position. Put the footrest, armrest back into the position and remove the brakes.
Moving towards the next strategy, that is floor to wheelchair using the backward approach. A. The aim is to improve the ability to move from floor to wheelchair using the backward approach. Physiotherapist instruction. Remove the armrest and footrest. Move the wheelchair closer to the patient so that the transfer be easy. Put the brakes or locks on. Step 1. Positioning the leg and hands. Patient position himself closer to the wheelchair so that his back touches the seat. The legs are passively flexed. The hands are placed at both the front corner of the seat. Step 2. Lifting and shifting the body. The elbow is gradually extended to lift the body gradually upward into the seat. Step 3. Sitting into an upright position. The patient holds the wheelchair to shift himself into a comfortable upright position. Putting the armrest down, the patient will then lift the cushion from the floor and put it by the side of the seat by folding it into a half. The next step would be lifting himself vertically to adjust the cushion into the seat. It can also be performed by laterally shifting the body to one side and simultaneously adjusting the cushion. Moving towards the next one, that is wheelchair to floor. It can be done by reversing the steps of floor to wheelchair. Patient instruction. Remove the armrest and footrest. Put the brakes or locks on. Step 1. Moving to the front edge of the wheelchair. The elbows are extended and the shoulders are adducted and depressed to vertically lift the body. The shoulders are then extended to push the trunk and legs forward on the seat. Step 2. Extend the legs passively. Step 3. Lifting and shifting the body onto the floor. The patient will position himself keeping the elbow extended and then gradually flexing it to lift and shift the body onto the floor. Moving towards the next strategy, that is floor to wheelchair using the frontward approach. Aim. The aim is to improve the patient's ability to move from floor to wheelchair using the frontward approach. Physiotherapist instruction. Remove the armrest and footrest. Move the wheelchair closer to the patient so that the transfer be easier. Put the brakes or locks on. Step 1. Positioning the legs and hands. The legs are passively flexed inward towards the underbelly of the wheelchair. One hand is placed onto the ground while the other at the front corner of the wheelchair. Step 2. Lifting and positioning the body into the wheelchair. Maintaining this position, the patient will lift and push himself upward until he can place his hands onto the front corner of the seat and reach a high kneeling position. Step 3. Twisting and rotating the body into the wheelchair. Using the hand position as fulcrum, the patient will then twist and rotate to land the buttocks onto the seat. Step 4. Shifting and positioning into an upright position. The elbows are extended and shoulders are adducted and depressed to vertically shift the body into an upright, comfortable position. Putting the armrest down, the patient will then lift the cushion from the floor and put it by the side of the seat by folding it into a half. The next step would be lifting himself vertically to adjust the cushion into the seat. It can also be done by laterally shifting the body to one side and simultaneously adjusting the cushion. The reverse of these steps can be performed to move from wheelchair to floor. Moving towards the next strategy, that is floor to wheelchair. Aim. The aim is to improve the mobility from floor to wheelchair in paraplegia. Physiotherapist instruction. Remove the armrest and footrest. Move the wheelchair closer to the patient so that the body is positioned at the right angle to the chair. Put the brakes or locks on. Step 1. Positioning the leg. The body is positioned at the right angle to the chair. The hips and knees are fully flexed and the feet is positioned alongside the footplate. Step 2. Positioning the hand. The right hand is placed onto the front corner of the seat and the left hand is placed onto the ground next to the hips. Keep in mind the right forearm needs to be perpendicular to the ground. Step 3. Lifting and rotating the body into the wheelchair. The right arm is adducted to pull the body laterally and the left arm is abducted and depressed to lift and move the body laterally. Step 4. Positioning the buttocks onto the wheelchair. The right elbow is flexed to further pull the body laterally and the left arm is further abducted and depressed to lift and push the buttocks into the wheelchair. Step 5. Moving into an upright position. The right hand holds onto the wheelchair and pulls the body into an upright position. The left hand is moved up from the ground. Putting the armrest down, the patient will then lift the cushion from the floor and put it by the side of the seat by folding it into half. The next step would be lifting himself vertically to adjust the cushion into the seat. It can also be done by laterally shifting the body into one side and simultaneously adjusting the cushion. The reverse of these steps can be performed to move from wheelchair to floor. Moving towards the next strategy, that is wheelchair to stool in paraplegics using the self approach. Aim. The aim is to improve the ability to transfer from wheelchair to stool using sideway approach. Remove the armrest, footrest, move the stool of same height closer to yourself so that the transfer be easier. Put the brakes or locks on. Move the casters forward. Step 1. Positioning the hand. The right hand is placed onto the stool and the left hand onto the front corner of the wheelchair. Step 2. Lifting and shifting the body. The elbows are extended and the shoulders are adducted and depressed to vertically lift the body. The right shoulder is adducted and the left shoulder is abducted to laterally shift the body. The same approach can be used to move from wheelchair to cupboard in the patients where he can take the support of the side bars. Moving towards the next strategy, that is from wheelchair to bed in tetraplegics. Aim. The aim is to improve the ability to transfer from wheelchair to bed in tetraplegics. Physiotherapist instruction. Move the patient closer to the pin so that the transfer becomes easier. Make approx 40 to 60 degree angle with the pin. Patient instruction. Remove the armrest and put the brakes or locks on. Step 1. Moving to the front edge of the wheelchair. The head and trunk are extended over the back of the wheelchair. The hands are pushed in behind the back. The hips are levered forward by external rotation of shoulder and extension of wrist. The sides and top of backrest are used as fulcrum. Step 2. Lifting the first leg onto the bed. The left arm is hooked around the back of the wheelchair to prevent forward fall. The right arm is used to lift the leg onto the bed. The leg is held with wrist extension hook. Step 3. Lifting the second leg onto the bed in the same manner. Step 4. Positioning the hands. The left hand is placed onto the bed and the right hand on the apex of far wheel. The passive stretch of hamstring muscle prevents the forward fall. Step 5. Lifting and shifting the body onto the bed. The shoulders are externally rotated and depressed and elbows are passively extended to vertically lift the body. The left shoulder is adducted and the right shoulder is abducted to shift the body laterally. The same steps can be reversed to make the patient transfer from bed to wheelchair in the same manner done previously in paraplegics.